Hi everyone, I'm Dr. Ford and I'm leading you through a 6-minute brain workout on continuous electronic fetal monitoring, the basics, and this is part 2. Let's first talk about accelerations. So you'll see this strip here and there's 3 accelerations on it. And acceleration is a visually obvious increase in the fetal heart rate. They usually peak in about 30 seconds. And what do these mean? Well, it means that the fetus is responding to a contraction, most likely, or responding to some other stimulus, and that they're actually getting a mini workout and their heart rate is responding appropriately. So it means that we have a well-oxygenated fetus. But on the flip side, let's talk about decelerations. So a deceleration is an obvious decrease in the fetal heart rate. So you can see this one here. With return to baseline. And there are different types of decelerations, and what we have on the screen here, these are early decelerations. Early decelerations are a visually obvious decrease in the fetal heart rate that's a little bit gradual, and it happens at the same time as a uterine contraction. So you can see here that the base of the deceleration is happening at the same time as the peak of the contraction. And what's happening here is the vasovagal response, and it's because the fetus's head is actually being squeezed by the contraction. So pressure on the fetal skull then changes the cerebral blood flow and it stimulates the vagus nerve. And the heart rate will generally, gradually increase back to normal as soon as the contraction stops or decreases. And early decelerations are usually benign. They're usually not associated with fetal hypoxemia or acidosis. Now, late decelerations, on the other hand, are bad news. So an early deceleration and a late deceleration can kind of look the same, but the difference is when they happen. So an early deceleration happens at the same time as the contraction, but the late deceleration, like the ones that we see here on the strip, they happen right after the peak of the contraction. So you can see here's the peak of the contraction, and so after the peak then we have the fetal heart rate decreasing gradually. The cause of late decelerations is usually placental insufficiency, which can be caused by a number of things. Anything that can affect the placenta and its ability to oxygenate can cause late decelerations in the fetus. So things like excessive uterine contractions, maternal hypotension, maternal hypoxemia, placental abruption, placenta previa, any of those things can cause late decelerations in the fetus. And late decelerations do indicate hypoxemia and also fetal acidosis. So they're a bad thing. Let's talk next about variable decelerations. And a variable deceleration is, unlike early and late decelerations, it's an abrupt drop in the fetal heart rate. They're characterized by a sudden and abrupt drop in the fetal heart rate, and then they usually have a similar abrupt change right back to baseline. And the shape oftentimes is like a V or sometimes even a W. Variable decelerations typically are caused by umbilical cord compression. So sometimes with a position change for the mom, we can get those to go away. So variable decelerations with normal fetal heart rate variability usually don't indicate hypoxia, but if these variable decels are repetitive and they're severe and we don't have good fetal heart rate variability, then we might start thinking about hypoxia. Okay, so let me go on to the next one. Here is veal chop. So this is actually an acronym for you all if you need some help remembering all of this information. So you can see here when you spell them out together, it matches up the change in fetal heart rate with the cause. So the variable deceleration is caused by cord compression, and early decelerations by head compression, and so on. So use that slide to help you learn and recall these changes in fetal heart rate. Okay, so we just covered a lot of information, and I want to ask you this last question about fetal heart tones. So which of these fetal heart tones, which of these strips that we've looked at in part 1 and part 2, what would you consider to be reassuring fetal heart tones? What would you consider to be non-reassuring fetal heart tones? So I'm going to leave you with that question, and you just completed a 6-minute brain workout on continuous electronic fetal heart monitoring, and you're done. Yay! Good job.